Caroline Pearson, Senior Vice President of Healthcare Strategy at NORC. I have worked in health policy and aging for about 20 years by bringing research and data analysis to critical business and policy questions. NORC at the University of Chicago is a nonprofit research institution, and we conduct a wide array of research for government and non-government stakeholders. And my team, the healthcare strategy team, really focuses on bringing research and data analysis to non-government clients across healthcare and other industries. Prior to NORC, I spent 14 years at Avalier Health, which is a policy consulting firm in DC, primarily working with healthcare payers, providers, and pharmaceutical manufacturers. And I have just always loved policy and the way that it can create huge impact for lots of people at once, and the way in which it's super complicated to get done. So I don't want for work because there's always going to be a policy challenge worth solving. In my current role, I am lucky to work on a wide array of aging issues, and I was really fortunate to work on the Forgotten Middle study that was published in 2019, which really highlighted the unmet need of middle-income seniors in search of affordable housing and care options. And since that came out, I have just been so struck at the impact that the work has had and how it has really changed the conversation by defining this market of middle-income adults who are unlikely to qualify for Medicaid long-term care, but also may not be able to afford private pay assisted living. And the work really created a call to action for new solutions from both industry and policymakers to address this unmet need. Since the Forgotten Middle, I have conducted several studies as well as surveys to understand how the COVID pandemic is impacting older adults in this country and how housing arrangements have affected COVID mortality rates. As I think about the biggest issue facing aging in this country, I am struck by the degree to which healthcare and housing remain completely siloed. In fact, as we age, our health and housing needs are fundamentally intertwined. And the healthcare sector has begun to realize the importance that social determinants of health and social needs have on health outcomes. But our policies and our payment models between housing and healthcare remain extremely fragmented. And as the baby boomers age, we need more integrated solutions to care for older adults who are going to face mobility challenges and cognitive declines, all of which are the things that may make it difficult for them to continue to live independently. As a healthcare person, I spend a lot of time working with Medicare Advantage plans that are intimately aware of the impact that people's housing and their surroundings have on their health. And so I think there is a huge opportunity for Medicare Advantage and seniors housing to work together to think about how to pool funding streams and really holistically provide better care to folks. If I could wave a magic wand to improve aging, I would really think about the core of our long-term care infrastructure. Too many Americans have not taken time to think critically about their care options and their preferences as they age. And at the same time, long-term care in this country is this complex web of service providers, payment models, and disparate information. And we just have no centralized system. We have no reliable source of guidance and advice. And too much of the care in this country is provided by unpaid family caregivers, most of whom are women. And so the result is that after an acute event, people find themselves urgently searching for support and trying to explore their options when they don't have the time and the space to think it all through. And often unsatisfied with the options available to them, we've got women leaving the workplace to take care of their parents at this time in need. And we have to build a better system to help families navigate this long-term care web, because we really owe it to ourselves, we owe it to our parents, and eventually we're going to owe it to our children. Definitely the best thing about Nexus is the fellows and both the expertise and the diversity of perspectives that they bring together. These are complicated challenges that we face as a country, and no single point of view is going to get anything done. So I think Nexus has the power to really bring together a wide variety of perspectives to try to solve problems and to try to innovate and to try to lead the conversation in this country. Because if we don't understand and respect those perspectives, we're not going to be able to make progress. So I just see nothing but opportunity with this group, and I'm so excited to be involved.